Take it away, Stephanie.
Thank you so much, Francesca, and good morning, everybody. It's so nice to be with you today. I am speaking to you from Knoxville, Tennessee, where I live, and we're going to talk about prevention fundamentals today. And this is one of my favorite things to talk about. When Francesca was talking about being DFC ready to apply for the Drug Free Communities grant, it's one of my favorite things to talk about because it's really positioning us to not only get funding to our community to help build infrastructure to address substance use prevention, but it's setting us up for a lifetime of sustainability. And it's one of the coolest things because if we follow this model that we're going to talk about today, we are not, we're guaranteed to see outcomes because the model is evidence-based, the model works, and it really gives us the opportunity to set ourselves up for success. And so we're going to dive into our objectives today. We're going to talk about the public health model. My background is in public health. My master's degree is in public health with a focus on epidemiology and biostatistics. And I was in the health policy track, got my master's degree at the University of Tennessee. And so I feel like that degree really set me up to excel in the field of substance use prevention. As community organizers, we really rely on that public health model. And so if that's a new concept to you, we're going to talk about that and really lay that groundwork for you to be ready to engage in a career in substance use prevention. We're also going to talk about the continuum of care because our work also aligns with that continuum of care in a very unique and distinct way. We're also going to talk about our roles in primary prevention and how they tie to both the public health model and the continuum of care. We're also going to talk about community coalitions and how we are uniquely positioned to affect change on the community level or the population level. We're going to talk about the strategic prevention framework. That's that model of change that I mentioned. We're going to talk about how it positions us to be successful, not only achieving the Drug Free Communities grant funding, but also being successful in our work. We're going to jump into comprehensive strategies and talk about how aligning those in a comprehensive complementary process allows us to have the proper dose of strategies to achieve change in our communities. And then I'm just going to touch on some foundational components that you need to have in place as a community to be competitive for the Drug Free Communities grant. So if at any time throughout our time together this morning you have questions, please feel free to unmute and ask that question or raise your hand or type your question in the chat box, and I'll be sure to keep an eye on that and address that. But I want to set this training up to be helpful for you. And so if there's something that's popping around in your mind, go ahead and ask that question, because if it's in your mind, it's probably in somebody else's mind as well. So please feel free to ask those questions as they come about. We'll go ahead and jump into objective one, and that's talking about the public health model and the continuum of care. And so I like to start with the river story. Has anybody ever heard the river story before? Okay, Jody has, Alyssa has, Rhiannon. So some people have, maybe not everybody, but I think it's a good foundation for us to start with today. So the river story is this concept that there are people who, if you see over to the left of our screen, there's some people who are approaching what seems to be the end of the river before there is a waterfall. And so these people find themselves in the river in distress. And from a general risk factor standpoint in our communities, the natural inclination of people is to jump in the water or throw some life-saving device to these people to get them out of the water. But the thing about it is, if we never stop saving people from the water and don't go upriver or upstream to figure out why they're falling into the water in the first place, then all we're going to do is spend all of our resources trying to pull these people out of the water. And so coalitions are the entities in the community that go upriver or upstream to figure out why people are winding up in the water. And so if you see in this picture, we've got people walking, but there's a big crack in the bridge. And so what coalitions do is move upriver and fix the crack in the bridge so that people are less likely to fall into the water. And so if people aren't falling into the water, then we don't have to expend our resources rescuing the people who are about to go over the ledge of the waterfall, because people don't find their way into the water in the first place. And that's what coalitions do. But we work all the way through the stream. We work upstream, on repairing the bridge, but we also work downstream to prevent the people from going over the ledge. This is important because it helps us to meet people where they are. We're going to talk later today, if you're joining us in the second session, we're going to talk about cultural competence and health equity, and this concept is going to come up in that session as well. But the reality is disparities exist in our communities, and there are people who have to cross bridges every day that have cracks in them. And we've got to meet those people where they are on their cracked bridge. But there are also people who are walking across bridges that might be walking across the same body of water, but their bridge is nice and pristine and very clean and new. We're going to meet them where they are as well. But the reality is, people in our community, some people get way more than they need, where some people get less to where it really isn't even helpful. Equality is when we give everybody in the community the same thing, assuming that the same support is going to benefit everybody. Equity is where we kind of are moving along this continuum where about 15 years ago, we were having a conversation about how, oh, we need to move to equity, we need to move to equity. But in reality, equity is when everybody gets the support that they need. However, there is still a barrier to full participation or full inclusion or full wellness, whatever the case may be. And so this idea of justice is where we remove the barrier or the inequity that exists in the community. And so when we talk about moving upstream in substance use prevention, that's exactly what we're talking about. And so I think this image to me helps us to identify that in our field of substance use prevention, we are meeting people where they are. We are not assuming that everybody in the community needs the same supports. We are meeting people where they are. And so when it comes to our comprehensive strategies, we must be comprehensive because we have to understand and we have to do some research. And Christina's going to be talking about this with you quite a bit when she talks about community assessment in one of your upcoming sessions. But that's where we really dig in and collect data to help us identify where people are in the community. If we don't have the data to help us understand where people are in the community, then we don't know what to do or how to get to meeting them where they are. And so when we think about prevention from the public health approach, we have, of course, the agent, the host, and the agent is working with the host in this greater environment. So the public health model is a triangle. It's agent, host, and environment. And so we have the host, we have the agent, who are all living in this community together and are exposed to risk factors, or sometimes we call those root causes. But the cool thing about a community coalition is we are perfectly positioned to work in that environmental or population level space. So in our field, you'll hear people, if you're new to the field of substance use prevention, you will hear people talk about environmental strategies, environmental change often. We are not talking about the environment as it comes to climate or plants and animals, which I think is the first thing a lot of people think about when they hear us talk about environmental change. When we are talking about the environment, we're talking about the place in which all of our people live, work, or play. We're talking about population level change. So we're meeting all of the people in our environment. And that's the public health approach. And so when we think about the public health approach as it applies to prevention, we want to be able to identify the agent, we want to be able to identify the host, the environment, and then come up with strategies so that we can identify and meet people where they are across the continuum of care. And so one easy way to think about this is a frog in a pond analogy. And if we continuously have frogs who are getting sick, and we just take those frogs out of the pond and we treat those frogs, we're just doing what they were doing in the river story, where they were rescuing one person at a time. But if all of our frogs are getting sick, at some point we need to go upstream and figure out why all the frogs are getting sick. Maybe we do a water test and identify that there's a harmful bacteria in the water. When we treat the water, we thereby treat all of the frogs or treat their environment, and we can come up with a solution to treat all the frogs at the same time. So in our world, when we talk about the agent, we're talking about the substance that people have the potential to misuse. When we talk about the host, we're talking about the person who is at risk of misusing or using that substance. When we talk about the environment, we're talking about where it's happening, the location that it's happening. And then we can come up, if we know the agent, the host, and the environment, Or, in other words, if we know the substance, the person at risk, and where the risk behavior is happening, we can then come up with a comprehensive set of strategies that will address change on the population level for everybody who fits that description. So again, this is just another visual of a different way to conceptualize the public health approach. Understanding that the public health approach is that triad. The technical term for that is the epidemiologic triad: the agent, the host, and the environment. And so the agent, again, what drugs are being misused? How are they being misused? The host is who is misusing those drugs, and the environment is the where, the what, how are they being misused? And our strategies are going to have the ability to impact all three of these elements. The continuum of care is a model introduced by the National Institute of Medicine, and it gives us this concept that health promotion begins over on the left side of the continuum of care, that bluest most slice. And so here in health promotion is really just giving a blanket message across our entire population. So health promotion is going to be pretty generic in scope. Think about some of the commercials you see on television that have a health-related message. That's what we're talking about here. So health promotion are going to be things like commercials that are encouraging people to get their seasonal flu vaccine, or strategies to talk about the dangers of secondhand smoke. Those are going to be health promotion related messages. They're going to be universally applied to everybody in a population. And so the thing about the continuum of care is, as we move from left to right, we are going to make our population smaller. In the public health approach, it looks more like this. It's a triangle. And so when we get into prevention, so here's our prevention slice. We have three slices within prevention. We have universal prevention, we have selective prevention, and we have indicated prevention. So remember, as we move from health promotion across to aftercare, our population goes from everybody in health promotion to just a few select people who make it all the way across to aftercare. The same is true for the prevention slice of the pie. Universal prevention is going to be every single person in our population a focus. So now we're moving from universal into selective prevention. Selective prevention are going to be the at-risk members of our population of focus. In some communities, we would refer to those members as at promise members of our population. And then we move from selective prevention into indicated prevention. Indicated prevention are going to be the highest risk members of our population. And in many cases, they are persons who have already engaged in at least experimental use or engagement of the problem behavior. When we take this prevention piece over to the public health model, we call it primary, secondary, and tertiary prevention. So where universal prevention is primary prevention, selective prevention is secondary prevention, and indicated prevention is tertiary prevention. The same rule applies. Some people conceptualize it a little bit better with the triangle approach, the pyramid approach, because primary prevention at the bottom slice of our triangle is the largest, which means it's the largest subset of our population. The secondary approach is a little bit smaller approach, the more selective approach to our population. The tertiary approach, that tallest part of the pyramid, is our indicated approach, the highest risk subset of our population. So when we think about the public health model and the continuum of care, we are living here in substance use prevention. However, there's a very important distinction with the continuum of care, and that is this red arrow right here. And that is what we often call that 90-degree line we often refer to as the point of diagnosis or the point of intervention. Because from indicated prevention, when there is a diagnosis, we move into the treatment side of the continuum of care. So case identification, standard treatment, and then we move into long-term recovery and aftercare. But the thing about the continuum of care, where you see that arrow across the bottom here, recovery becomes that individual's primary prevention or universal prevention. And so they are able to cycle through the continuum of care. Any questions about the continuum of care before we move on from here? So when we think about the universal selective indicated or primary, secondary, tertiary prevention, our universal is reaching everybody in the community, our selective is a smaller subset, and our indicated prevention is reaching an even smaller subgroup, and in some instances we're reaching one person at a time. Cool thing about universal prevention is we come up with strategies, and our population-based strategies, or what we call environmental strategies, which we're going to talk about a little bit more. When we engage in one strategy, we have the ability to affect change for every member of our population of focus. Not necessarily true for the indicated population because it's a smaller subset of the population. So, quick question for you, and feel free to either engage in the chat box. You can give me an answer in the chat box, or if you would prefer, raise your hand and I can call on you and we can have some dialogue. But how do you describe, for those of you who have been in the field for long enough to have had explain this, how do you best describe the public health model to members of your community in a way that's easy to understand for them? Some of your nonverbals, and by the way, thanks for having your cameras on, because some of your nonverbals are saying, yeah, I wish I had an easy way to do it. Why don't you just give it to me? So the question is, how do you describe the public health model to members of your community in an easy way they can understand? Has anybody ever tried to do this? Okay. So thank you, Kaylin says, I haven't worked in the field, but I believe it can be hard. Having on hand the information that breaks things down might help. So I'm going to give you my elevator speech that I use in the community, because I did throw a really difficult question at you first thing early in the morning. But when I'm talking to the community about the way coalitions work, one thing that I want to get across to them is we meet people where they are. We have strategies for our entire population. But we also have strategies for members of our population who are at greater risk of engaging in substance use. And then we have even additional layer of strategies for people who are already engaged in the risk behavior of substance misuse. And we come up with a comprehensive and complementary set of strategies to meet people where they are, to ensure that everybody in the community has access to the protective factors that our coalition is pulling together collectively. So I think what's important is that culturally, we've got to figure out what the language in our community is, and we have to be able to tell that story in a way that's meaningful for our community. So your task is to try to now take this information and package it in a couple short sentences so that when you're out talking in the community, you have the ability to connect with people on a level that they understand how you engage in prevention. Because how many of you, so let's start from the very basic. How many of you work in the field of substance use prevention? Show of hands. Some do, some don't. How many of you have been, of those of you who raised your hand, how many of you have been working in the field for more than 6 months? Okay. How many of you have been working in the field more than a year? More than 5 years? More than 10 years? Okay, we've got some tenured people out there. So how many of you who raised your hand to any of those questions have been out talking to a community group and somebody says, oh, wow, you work in substance use prevention? How do you go to work and keep doing that job every day? Because in their mind, it's something that's insurmountable, something we can never do anything about, right? Anybody? I knew I wasn't the lone wolf. Yeah, I see your hands. People have a hard time conceptualizing how we overcome some of these systemic issues that our communities face. But we have a process and we have a model that is very effective. And so we've got to figure out how we reach those individuals to give them hope that we can make a difference. And so if we can package this public health model and explain it to them in a way that gives them hope, that inspires them, maybe they will be part of that change because their engagement, their empowerment is an important aspect to our effective work in prevention. Let's jump into objective 2. We're going to talk about community coalitions now and the unique role that we can play in communities. So starting a coalition is really just starting a movement. So what is a coalition? Well, it's really just a formal alliance of a very diverse group of people, but we come together to address a specific community issue, to solve problems, and to work collaboratively toward a goal that we come up with together. We're stakeholders that represent various sectors across the community. There are 12 sectors, in fact, sectors that include law enforcement and schools and healthcare organizations, faith institutions, parents, youth, youth serving organizations, civic and volunteer groups, local government, and other organizations engaged in reducing substance use. And so all of these entities from all across the community work together, because if we super saturate the community with prevention-based messages, we're more likely to meet people where they are. And so we're able to collaborate together to pool our resources and our knowledge to make sure that if somebody's going to a faith community, we can reach them in their faith community with protective factors that offer healthy messages. If people are visiting healthcare providers, we can meet them there. If people are engaged in public policy or live in a community that are affected by the laws and ordinances that shape behavior in their community, we can meet them there. If they attend school, we can meet them there. And we could go on. I think you get the idea. So our community coalitions are diverse, and we're working to collaborate in a formal structure. So we fill a unique role because we're addressing complex issues, but we're doing so from a holistic approach. We're really wrapping around not only the whole person, but the whole community, understanding that there are a lot of risk factors that come into play, and the more protective factors we can introduce to mitigate that risk, the easier it's going to be for us to tip the scale. Think about the scale of justice. And there's a fulcrum in the middle and it can swing back and forth. If we have just pile in the resources on one side, then we're going to tip the scale, and they're going to be so many more risk factors than there are protective factors. But the more protective factors we build in, we can balance those scales so that people have enough tools in their tool belt to go out and make the healthy choice when introduced to a decision that they have to make. We also are uniquely positioned to collaborate with other agencies and to coordinate with them so that we don't duplicate services across the community, but we maximize our approach. Because if we've got people who are running a youth serving organization, maybe it's a Boys and Girls Club or YMCA that has an after school program, we can implement just a tiny little piece of what they're doing to offer some protective factors for youth so that they have some life skills that they can use in all facets of their life. We also have the opportunity to amplify community voices. We leverage resources. We build capacity. We empower people because people can then feel like they're part of the solution. We also can sustain long-term change. When we think about that long-term change, that's really our goal, because we don't want to just come in and make a change for a year or two. We want the changes that are instituted in a community to be long-lasting. We want that impact to be able to be seen over the course of generations. So how has and you don't even have to work in the field of primary prevention to answer this question, but how has your coalition built capacity to fill a niche in your community? Did you see a need and say, hey, we need to come up with a solution to fill that? What have you done in your communities? And thank you, Ronell, saying increasing messaging at convenience stores if they card under 21. So, an important capacity piece, especially if we've got a problem of retail access to alcohol and we've got stores that are selling alcohol to persons under 21 or tobacco, even. If we increase the messaging that they're not going to do that, people are going to be more likely, adolescents and young adults are going to be more likely to try. That's a good example. And thank you, Jody. Coalition is hosting a faith based luncheon today to get more active participation in coalition efforts. So that's a great way to say, hey, we're going to offer a meal. Our society is often revolving around a meal together. When we share food, we have the opportunity to network and gives us an opportunity to really build some of that capacity. Great examples. Kaylin says resource fairs, another way to recruit people, also to help get messages out about opportunities in the community. Great example. And sometimes it's really just the right person being at the right place with the right voice to say, hey, we've got an issue that is affecting our community in a certain way, and we want to do something about it. Katrina says, we listen to feedback from local substance use hubs, from stakeholder meetings, treatment agencies, families, and work to implement programming to address. For example, vaping concerns from schools made Catch My Breath available to all 33 schools in the districts in the 3-county area. That's a really great real life example of what I was trying to say. And so that was from the board's perspective. But thinking about how there was an issue identified in the community, there's a group of people who said, hey, we don't like this, but we want to do something about it. So they collaborated to pull together the resources. So now they're serving the needs of the students in those school districts. Thanks for that real life example, Katrina. Very nice. Okay, let's keep cruising. So we've got objective 3. So now we're diving into the strategic prevention framework and thinking about how it positions us to get to a place where we can be successful. This is the strategic prevention framework. How many of you have ever seen this image before? See some hands, but not everybody. So the strategic prevention framework is a framework that has been put forward by SAMHSA, Substance Abuse Mental Health Services Administration. It's a department of the Health and Human Services of the United States government. And the strategic prevention framework is pretty awesome. It's one of my favorite things to utilize because it's effective and it's evidence-based. And if you follow the process, it also works. I like knowing when I go into something that I'm going to win. And so this gives us the training, it gives us the power to be able to go into a community and initiate change. So most of the time, we're going to start in this assessment phase. We're going to begin an assessment because the assessment phase helps us to make data-driven decisions. When we make data-driven decisions, it pulls the subjectivity out of the conversation so that when we look at our data, we know what the data are saying. And as long as we have triangulated our data, people can't argue with the facts. So we start from assessment, but you see that this process, we've got assessment, capacity, planning, implementation, evaluation, but you see sustainability and cultural competence here in the middle. Sustainability and cultural competence is in the middle because the strategic prevention framework is very much like a spirograph. So some of you might not remember, but I bet many of you remember the spirograph like I had when I was a kid. Anybody remember a spirograph? Did you have one of the little plastic discs that had the holes in them and then the outer rings, and you could put the disc in the ring and pick one of the holes? And the best part, y'all remember the best part, right? The 4-colored clicker pen. That was my favorite part. And so when you put your pen, whatever color you chose, in one of those holes in the disc, it gave you the opportunity to make this image kind of like this. But if you kept going, it just became more intricate and more intricate and more intricate because we could just keep going around and around in a circle. That's what the strategic prevention framework is like, because we don't necessarily ever stop moving our way through the strategic prevention framework of focus, but we're going to assess our population of focus by making sure that we're being culturally competent in our approach. Then we're going to build capacity around our gaps in services that we might identify. We're going to build capacity around the problem issues that we uncover in our assessment. And then we're going to build capacity in order to sustain our efforts. Then we're going to move into a planning phase, but we don't want to plan without cultural competence, because one of our biggest mantras in the field is nothing about me without me. We don't want to plan for a group of people. We want to plan with a group of people, especially persons who identify as being marginalized or have historically been marginalized as a group of people.
Stephanie, it looks like you froze up a little bit. We'll pause for a second to see if she can come back in.
Apologies, friends. My internet connection apparently just decided to drop off. Thanks for your patience. So when we think about, let me first check in. What was the last thing you heard from me?
I think you were just finishing up the strategic prevention framework, kind of the circle of it all, talking about cultural competence. We'll take another pause for a second as Stephanie battles her internet connection. Thank you all for your patience.
Am I back?
You're back.
Okay. Sorry about that. You know, I have fiber internet on my house. You think that that would be pretty reliable, but here we are. So
There's always something.
tell me what the last thing you heard was. I was talking about the strategic prevention framework. I was at planning, talking about nothing about me without me. Did you catch that piece?
That was
Okay.
the last thing that I heard.
Cool. I'm going to pick up right from there, and we're just going to hope that doesn't happen again. But if it does, I'll hop on my phone. So we come through planning, jumping back into this cultural competence piece, because we want to make sure that we're planning with members of our community, not for them. Their engagement is critical to our success. And so we loop from planning back into cultural competence, but we also want to be culturally competent when it comes to implementation. And we want to make sure that our implementation is sustainable. Our implementation becomes sustainable when we're truly collaborative in our approach, because we want to make sure that our coalition is the think tank of ideas. We're using data to drive our planning. We're using data to drive our strategies, but we don't have to be the entity that carries on and implements those strategies in perpetuity. We can be the driving force behind starting them and then finding another entity that might be most appropriate to carry on that strategy for forever in our community. And so we cycle back through sustainability, cultural competence, but then we also want to evaluate our work. We want to evaluate our work for a number of different reasons. One, we want to be efficient in the way that we're using taxpayer funding. Second, we want to be efficient because we want to make sure that all of our time and our resources that we're putting into implementation are effective. And so we evaluate our work, but we also want to make sure that we are culturally competent in that, to make sure that, think back to that image of health equity and disparities that we identified. We want to make sure we're meeting people where they are, and that everybody in the community is getting the resources and the services they need, not just what we think they want or we think they need. And then we also want to evaluate for sustainability. If we identify that something we're doing isn't working 100%, we can make some minor modifications so that we can move forward and be more efficient in our approach. And then we just cycle back through assessment. Why? Because in a year's time, we're going to have some new data that we can pull in, and hopefully our approach has given some change to the community. So we want to monitor that change. And so we just keep cycling through the strategic prevention framework as long as we exist. So, when we think about the strategic prevention framework model, you'll hear people refer to this as the SPIF or sometimes even the SPIF flower. Really positions us for success, as I mentioned when we kicked off our Zoom today, because it's a comprehensive approach. We're not just going out in the community and doing what feels good. We're going out in the community and we're working comprehensively with other entities, collaborating and using data to identify the problems and to identify the effective solutions. The strategic prevention framework model is also empowering. It empowers people to be part of the change that they want to see in the world. And it engages them because when somebody is part of the planning process, they are much more likely to be part of the implementation or part of the solution. So if we allow people to come in and share their own ideas, if it's my idea that I want to go replace the flowers in my front flower bed, then I'm likely to go to the store and buy them. I might ask for some help from the other people who live in my house to help plant those, but I'm going to have some engagement and buy-in to make sure that those those flowers are watered so that they are sustained. The same is true for our community work. If people are part of coming up with an idea, they're going to be more likely to be part of implementing that idea and sustaining that idea. We also are evidence-based. Our model is evidence-based. If we use data to identify a problem, we build capacity around that problem with cultural competence and sustainability in mind. We plan comprehensively with members of the affected population, and then we implement with fidelity. We evaluate our work with sustainability and cultural competence in mind. We are almost guaranteed success. And so it gives us this step-by-step method that step one, collect data, community assessment. Step two, build capacity. Step three, review cultural competence. Make sure you're engaging members of the population of focus in your planning. Move into planning. Implement your work. Evaluate it. If we do these things, we're guaranteed to initiate that change. So I know several of you raised your hand that you were familiar with a strategic prevention framework. What success have you, if any, experienced from implementing the strategic prevention framework model in your community? Let's hear from some of you who have experience there.
Can I just chime in? Is that okay?
Yeah, go ahead. Thank you so much.
Absolutely. I guess the question is very broad, so it's hard to sort of narrow it down. We've been doing SPIF for some time within our community, and I would say like some of the most success that we've seen has been with the capacity building component and being able to continuously bring multiple sectors into the conversations. We have also had a long-standing campaign that was based off of SAMHSA's, I'm not going to get it right because in our community it's Talk to Your Kids, but similar to their campaign. So that has been something that has allowed us to educate broadly and continue to utilize that message with the foundation of the assessment information that we're doing within our community.
Awesome. Thank you so much, Rhiannon. So, just to summarize, there was data collected, there was a campaign, I think you're talking about Talk They Hear You from SAMHSA, that was identified that tied into the root causes, the local conditions that were identified in the data collection and planning piece. And so there was a cultural element also, thinking about cycling back through cultural competence. It was adapted a little bit to meet the cultural needs of the members of the population of focus. and then implemented with fidelity because they had members of the population of focus engaged in that planning. And that's exactly what we're talking about here. That's a great example of that success of implementing the strategic prevention framework. And so it gives us a little bit of flexibility. I think one of the coolest things, we're talking a little bit about the Drug Free Communities Grant today. I think one of the coolest things about the Drug Free Communities Grant is it gives us the opportunity to identify the problems that we want to address in our communities. It's not a grant that says you're going to address underage drinking or you're going to address opioid misuse in your community. It gives us the opportunity to go dig in the community and figure out what our community needs are. And by the way, where community readiness is with respect of those needs. And then we can come up with our own plans. So it doesn't tell us what to do. It doesn't tell us what our problems are. It's one of the most unique federal programs because it gives us the ability to do that on our own. That's why the strategic prevention framework as a model positions us in a really, really good place to be able to initiate this change, to be one of those change makers in our communities. Anybody else have a success that you'd like to share? Then we will move along into objective 4. This is where, and we are cruising through this concept. There are trainings where I spend an entire day on each of these concepts that we've already talked about. So you're definitely getting the 35,000 foot view of these concepts. So it gives you an opportunity to dive a little deeper. And I know Christina Clark is going to be with you in one of the upcoming training sessions. And Christina is going to really be diving into some of the products or some of the components, the planning components that go along with a strategic prevention framework. So make sure to tune in for those so that you can have an even deeper grasp of those planning elements. We're going to talk about the concept of comprehensive strategies and how designing those complementary and comprehensive strategies is important to achieving population level behavior change. And so the first concept, think back to the frog in the pond analogy that we used earlier. The concept of our strategies is that we want to reach the denominator. So put on your middle school math hats and tell me what a denominator is. It's not a trick question. Not a trick question. What's the denominator in mathematics? If you have a fraction, the denominator is what? It's that bottom number, right? The denominator is our entire population. So if we're thinking of strategies, we want to make sure that we come up with strategies. So here's our fraction. Let's say our denominator is, this would be a very small community, but just for the sake of easy math and me not having to annotate with a mouse a whole bunch of numbers, let's just say our denominator is 1,000. So if you have 1,000 people in the community, individual strategies are impacting small groups of people. So what are some individual level strategies that you all have implemented in some of your campaigns? The Talk They Hear You was one that I heard. And they ran and changed the name of that a little bit, but I'm saying Talk They Hear You. Let's say that reached 250 people in this community of 1,000. So we've got 250 people. What are some other individual strategies that you all have used in your communities? Let's see, somebody mentioned one. Jody mentioned a faith-based luncheon. Let's say your faith-based luncheon brought 35 people. Let's say we did another individual strategy and we did a life skills training in a classroom and we reached 25 students in that classroom. We have now 60, what's that? Is that 60? Yeah, we've got 60 to 310 people out of 1,000 there that we've reached through those individual strategies. But our goal is to reach the entire denominator here. So if we're going to reach the entire denominator, we've got to come up with those population level strategies that are going to reach a larger subset of people. So let's say, for example, same denominator, we've got 1,000 people. Let's say we pass a policy in the community that, let's go back to somebody else had an example about messaging at convenience stores carding under 21. Let's say that we sent the message to the convenience stores. That might help us reach 51 people, let's say. But let's say we had a policy change that required that every clerk that worked at a store that sold alcohol had to take a special responsible alcohol sales class. And they had to apply that learning and point of sale materials at the point of sale. Now we're going to effectively reach every single person who would check out at a retail establishment in a community. Let's say that's not everybody, but let's say 950 people over the course of a year are going to check out at a convenience store somewhere in the community. Now we're starting to reach that denominator. And so if we keep coming up with these population level strategies, we are now having the ability to impact change among everybody, that whole denominator. And so when we think about our comprehensive and complementary strategies, that's really where we're going, is the denominator. We want to make sure that all of our strategies, when added up, are well higher than our population of focus, because there are going to be some people in the community who are going to be touched. They're going to have multiple touch points of our strategies. Our strategies, as I mentioned, can be individually based, but they can also be environmentally based or population level based. Remember, we're using those terms interchangeably here. So strategies targeting the individualized environments, we're targeting individuals at one time. We might do that through their schools. We might do that through their healthcare providers or their faith community or their families. But when we graduate into those population level strategies that target the community or that shared environment, now we begin addressing circumstances in the community like community norms, or laws and regulations, or the availability of a substance. Now we are moving to affecting change with all youth at one time. Because let's take availability, for example. If an adolescent cannot access alcohol, period, an adolescent cannot drink alcohol. And so when we begin to shape those shared community environmental norms, that's when we are able to really affect change. Our strategies, the individual strategies, are those that provide information, build skills, provide support to individuals or groups of individuals. These might be after-school programs, school curricula, employment programs, or media campaigns. Our environmental strategies, or those population level strategies, are strategies that aim to change the conditions or the standards or the institutions or the systems and policies that shape our behaviors. Things like changing access or barriers, changing consequences to a behavior, modifying the physical design of the environment, or modifying policy or local ordinances. These types of strategies might be hours or days of sale. So we might be able to adjust the time of day that alcohol or vapes are sold in a community. Could be clean air laws, saying that it is now unlawful to smoke inside a restaurant. When I was a kid, it was totally normal to be asked when you walked up to the server if you want to sit in the smoking section or the non-smoking section. Today, almost universally, that's unheard of anymore. And so those clean air laws, those population level strategies affect the norms of everybody. Because imagine what it does for a kid or a young adult. Let's say we have a teenager, a 12-year-old, who's walking into a restaurant with their family, and the family says, first available, we'll just sit wherever we can get a table first. And that child is sitting there eating their dinner, surrounded by people who are sitting there smoking. what kind of message, what kind of norm does that create for that child? That's how the standards, the laws that we pass affect change when it comes to people's perceptions. Advertising ordinance also come into play. Opioid prescribing guidelines, open container ordinances, alcohol or retail compliance checks, are all those population level strategies that aim to affect change on the population level or on that broad scale so we can reach the entire denominator in our community. Here's an example of a logic model. So Christina Clark is going to dive into logic models extensively in one of the upcoming trainings, but we can't talk about strategies without talking about a logic model. And so a logic model begins with one, a problem statement. And our problem statement positions us, of course, we're going back to our community assessment, to the data that we've collected, to identify what we call root causes. Also, root causes are used interchangeably often with the term risk factor. So we identify these root causes that are backed by prevention science, and we come up with what we call local conditions or local behaviors. So the local conditions, the local behaviors, are the exact when and where and under what circumstance is happening. So when we say that this example is underage misuse of prescription drugs, and the root cause is, why do our youth misuse prescription drugs? Because they have favorable attitudes. What do their favorable attitudes look like? This example is student athletes use prescription pain medications not prescribed to them for acute injury during the athletic season. And so for every local condition, we have a comprehensive set of strategies that help us to frame that behavior change. So theoretically, if we educate students on the risk of sharing meds, and we also train coaches on monitoring prescription use among their student athletes, and we have prescribers who provide information to parents on the dangers of opioid misuse during adolescence, and the school institutes an injury management program, we have assessments and referral, screening, brief intervention, referral to treatment, SBIRT, for all injured athletes. We have drug sniffing dogs at school, and then we have a policy that's going to update the athletic, alcohol, and other drug policy to include assessments and referrals for violations. Now we can see how these begin to work together. I think one of the easiest ways to think about comprehensive strategies is with respect to speeding. Anybody here drive a car? Figured I'd see some hands. Anybody here who drives a car ever gone over the speed limit? You're in a safe space, not going to turn you into law enforcement, but I see a lot of hands out there. So you're driving a car. You likely know that you're not supposed to drive over the speed limit, right? How do you know? You've got speed limit signs about every couple hundred yards on the freeway. You've at some point built your skills by attending driving school, probably as a teenager. You are provided support by a speedometer on your dashboard that tells you the speed you're going. In some instances, you're provided support because there's a little Department of Transportation machine there that has a speed limit sign, and then it blinks your speed. When it blinks your speed, is it over the speed limit or under? You don't have to answer that question. But we also have barriers to speeding, because how many of you have ever driven down the road and there's a police car sitting there, or there's a motorcycle cop who's sitting there with a radar gun checking people's speed? We definitely have consequences for speeding. There are laws that say if you speed, you will get a speeding ticket. We also have some additional disincentives that if you get in a certain number of speeding tickets, you might lose your insurance or lose your driver's license. We have also, and this is what gets Stephanie Strutner every time, physical design. What are some physical design strategies that slow people down? Speed bumps. Speed bumps are going to get me every time. If I see a speed bump, I promise you I'm slowing down. Why? Because my bag is going to be overfilled beyond reasonable doubt. and it's going to fall out of my front seat and dump all of the contents into the floor, then I'm going to have to pick it all up and resort my purse, and that is a real problem for me. And so speed bumps is what it is for me. Some of you here might say, oh no, I do not speed because I see that speed limit sign and I pump the brakes. Some of you might see a police car and you're going to pump the brakes because you don't want that consequence of a ticket. But my point is, we're all here. Most of us are drivers and most of us have reported speeding. But in the community, we are talking about opioid misuse or cannabis use. And we say, why are you using these substances? You know it's harmful. You know there are consequences. But hey, y'all, we drive and we speed and we know that it's dangerous and we know that there are consequences. And so when we have this comprehensive set of strategies, we're more likely to, remember, meet people where they are, to provide the disincentive that's going to work for them. Because when my dad was living and he was driving, he was a law enforcement person. And so if he went 2 miles over the speed limit, he was speeding in his mind. He did not speed because that was the rule. I don't speed in neighborhoods because, one, I respect the lives of children who might be playing in the street, but also I don't want to drive down my road and my neighbors shame me because they're like, oh, that girl in that black car, she drives fast down the street every day. I don't want them talking about me on Facebook. So we all have our reasons. That's why we've got to meet people with these comprehensive strategies in the community to make sure that we hit all of those reasons. But we also have complementary strategies. And our complementary strategies, our next example gives a little bit better overview of what complementary strategies look like. Our comprehensive strategies identify, let's say this local condition is students get prescription opioids at school. We can provide information to school administrators on high trafficking locations in the school. That's one thing that coalitions do really well, is identify what's happening and where it's happening. So we can provide that information to the school administrators. We can also train teachers to identify youth under the influence or who might be concealing opioids at school. We can provide support by offering assistance to school administrators on restorative penalties, because we don't want to identify a kid at school and say, oh, you have misused an opioid, suspended. Because what are we doing? We are putting them out into a place, theoretically, where they're going to be engaged in more risk factors than they would be at school. And so our policy is that our school system mandates restorative programs for students getting caught with opioids at school. And we reinforce that by enhancing skills, because teachers, if they think that students are just going to be suspended because they're caught with an opioid at school, are less likely to report that student under the influence of an opioid. And so if we offer those restorative penalties and provide support, giving assistance to school administrators, making sure those restorative penalties are in place and that they are working, then the teachers are more likely to participate in that. Then we're going to collaborate with the school resource officers to monitor trafficking at the school. We're going to offer a treatment program as a consequence. So instead of suspension or a fine, we're going to allow these students to go get treatment for their opioid use disorder and then reintegrate them back into the school. We're going to have a physical design strategy of increasing the frequency of canines monitoring for opioids in school. And so you can see how the strategies begin to work together. That's what we call complementary strategies. And so our comprehensive and complementary strategies meet everybody in the community where they are, but they also work together to make sure that we can change that local condition behavior. And so I'm going to go back one slide because you can see that these strategies are tied to that one local condition. So for every local condition on our logic model, we're going to have a separate and comprehensive set of strategies for every single behavior or local condition that we have on our logic model. How many of you have ever used comprehensive and complementary strategies to achieve change in your community? Anybody ever had a comprehensive strategy plan? I bet some of you have. You might just not want to talk about it right now, and that's okay. I won't put you on the spot. But the use of comprehensive and complementary strategies to achieve change in your community is really one of those evidence-based pieces of the strategic prevention framework. I'll give you an example from my community. We had a real underage drinking problem. 34% of our 6th through 12th grade students were engaged in underage drinking in the past 30 days. That was pretty high. But when we did our community assessment and we dug down to figure out where our adolescents were accessing alcohol, I think it's just easy to say, oh, from home, oh, from the parents. But it was not the parents in our community. It was the retail establishments. And so when we identified through our needs assessment that the students were purchasing alcohol without age verification at the local retailers, we were able to go to the retailers through our law enforcement. So our law enforcement officers said, okay, we see this as a problem. There were consequences because there were fights, there were alcohol related traffic crashes from adolescents, there were police house calls to parties for underage drinking. So there were some consequences that were strong enough for law enforcement to say, okay, we'll be part of this. So one of our strategies was to assemble an underage drinking task force. We provided packets of information to everybody who signed up for a beer permit from our local beer board. We also collaborated with law enforcement to change the way they did compliance checks, because our community was small enough that they could actually go out and do compliance checks among all of the retailers in 1 or 2 days. And that's what they did. But guess what? Our retail outlets had phone trees. So when one failed a compliance check and sold alcohol to a minor and got a ticket, they called the next store down the road to say, hey, they're out doing compliance checks. And then that store called the next one, and that store called the next one. And so after the first 2 or 3 outlets, everybody passed. And it looked like there wasn't a problem, when in reality, when our law enforcement agents started to just do 3 or 4 outlets a day, and then about 4 or 5 days later do another set of compliance checks, our compliance rate was abysmal. It was very low. And so just by changing that, by having a fine associated with those outlets, and then having a law policy that mandated that they have a training class before they could sell alcohol at that retail establishment, we went from a 64% compliance rate in the county to a 100% compliance rate. This was back in 2011. And the compliance rate is still 98% in the community because they consistently follow the policies that were implemented then. As a result of implementing that strategy, underage drinking decreased by 53% because we were able to identify where our youth were getting alcohol. And so you can see how those comprehensive and complementary strategies can really position us to initiate change in our communities, and also how it's a collaborative approach. The coalition did not do that in isolation. The coalition collaborated with a lot of different people, the district attorney, the law enforcement, with school systems, with the local businesses, with the merchants and the store clerks, and with parents and with youth, to make sure that we could implement those strategies. So our last and final objective is objective 5. We're going to talk about the foundational components that coalitions should have in place to be drug-free communities ready. And so before I jump into this, has anybody ever written a drug-free communities grant before? Nobody has. Okay. Are your communities currently funded by the drug-free communities grant? Show of hands. Okay. Might be a really perfect audience of focus here today, Burke and Francesca. How many of you would like to consider applying for a drug-free communities grant in your coalition or community? Okay, awesome, some hands. So drug-free communities grant is a $125,000 grant that is renewable for 5 years, competitively renewed for up to 10 years. It does have a matching component. I think sometimes people, when they're sitting down to write the grant, panic about the matching component, but it's really easy to come up with that match. I will say with certainty, I have written more drug-free communities grants than I can count for different communities. I can say the one thing that made me a better grant writer was being a peer reviewer. So if you ever have the opportunity to be a peer reviewer for the CDC, Centers for Disease Control and Prevention, for the Office of National Drug Control Policies grants, do that, because it will take you it took me from being a mediocre grant writer to being a good grant writer in a very short amount of time. Because when we critique our own work, it's hard to do because some of the information is still left in our head. When we critique somebody else's work, it's a little bit easier because it's not ours, and what's on the page is what's scored, and if it's not on the page, it doesn't get scored. And I also joke often as a recovering grant writer, I joke that grants are never finished, they're just due, because we could keep refining and refining and refining our grants until the deadline, and they're due. So late grants or no grants. So anytime you're writing a grant, you have to make sure that it's submitted on time. Everything we submit now for the federal government is going to be submitted electronically. And, even with my internet that has never failed me in a Zoom, failed me today. So don't wait until the last minute to submit your grant. So you want to give yourself a little bit of window, because also sometimes your grants get kicked back for errors. If it gets kicked back for an error, you want to have the time to be able to go in and fix that error. So let's talk first about the integration of the elements of writing a drug-free communities grant. There are eligibility requirements. Second, there's the application. There are attachments and other required evidence. There is a scoring mechanism. They're electronically submitted, and then you have to also submit a timeline. So when we think about the eligibility requirements, you have to show evidence of 12 sectors. So all the sectors in the community, you have to have what's called a coalition involvement agreement with all 12 of those sectors. You write the coalition involvement agreement on your own, but there are some samples in what's called the NOFO. NOFO is the Notice of Funding Opportunity, and that's released by the CDC, the Centers for Disease Control and Prevention, usually at the very beginning of the year, of the calendar year, although that fluctuates a bit at times. But there are some examples in the NOFO of the coalition involvement agreements. You'll tweak it to make sure that it specifically meets your coalition's needs. And then my best recommendation is to have a big coalition meeting. Maybe your December or January coalition meeting, you say, hey, this is the meeting that we need literally everybody in attendance. And that's when you get your coalition involvement agreement signed. That way you're not running all over the community at the last minute trying to chase down those coalition agreements. You also, to be eligible to apply for the grant, have to be able to prove that your coalition has been in existence for at least 6 months. You show evidence of this from coalition meeting minutes with a list of people who attended. It's a good rule of thumb for your meeting minutes to show attendance of the people that represent the 12 sectors of the coalition involvement agreements that you've had signed. You have to have a mission statement for your drug-free communities grant, and it has to be youth substance use prevention focused. It'll spell out specifically in the NOFO, but it will say that you have to have youth in your mission, and it has to be substance use prevention focused. You are required in the grant to address multiple drugs of use. You get to choose what drugs those are, but it has to be at least 2. It can be more, but it cannot be less. You have to submit an evaluation and performance management plan. So think about the evaluation component of the strategic prevention framework. You have to explain to them how you're going to evaluate your performance and your work. You have to prove that you're an entity that's eligible to receive a federal grant. You do so by having an IRS letter of exemption. So essentially what that means is you have to show that you're a 501c3, or you have a fiscal agent who is a 501c3, and you have a memorandum of understanding between your coalition and that agency that's going to serve as your fiscal agent. Most of the time, I field technical assistance calls where people are having trouble with a fiscal agent. It's because the fiscal agent wants to take more control over the money than the coalition wants to give. And so, my recommendation is to be very, very clear and detailed in your memorandum of understanding between your coalition and a fiscal agent to make sure that one of the biggest problems that coalitions say is, I don't know how much money I've spent and I don't know how much money I have left. So make sure if you're going to have a fiscal agent that you identify in your memorandum of understanding how frequently they will offer profit and loss statements, your financial documents. I would say monthly at the very least, you should be able to know your financial position. You have to show substantial support from non-federal resources. That's what I mentioned where it's a matching grant. So if you're asking for $125,000, you also have to show that you can match $125,000. When you get into years 7 through 10, your match increases from 100% to 105%, 115%, and it goes up. But I see some of you taking deep breaths. Don't worry, this is the easy part. If you truly have a committed coalition, it is going to be no problem to come up with this match. And it's okay to enlist support of your coalition members and other people in the community who can help you write this grant. The federal request, as I already mentioned, is $125,000 per year for 5 years. And then at year 6 mark, you have to compete again. So it's non-competitive renewal for the first 5 years. Year 1, competitive application, but years 2 through 5, non-competitive renewal. Then you recompete for year 6. And then if you get year 6, it's non-competitive years 7 through 10. There is a requirement for a zip code overlay. So a lot of our communities, especially in the eastern half of the country, out west, it's a lot easier. Their zip codes are kind of blocks. Their counties have very clear delineations. Ours don't necessarily. And so sometimes we have a lot of zip code overlay that overlaps county lines, but a lot of our coalitions are based to serve a county or a school district. And so if you have zip code overlay, you just have to have a memorandum of understanding. If there is a coalition that has a grant in the county next to you or the region next to you, and you have zip codes that overlap, you just have to have a memorandum of understanding to identify who's going to serve which part of each of those zip codes. For me, it was pretty easy. We had 3 overlapping zip codes with another drug-free communities grantee. All we did is say that my coalition was going to serve the part of the zip code that lied in Anderson County, and the next door coalition was going to serve the parts of their zip codes that lied in Roane County. So it's pretty simple. It's just a formality. And then you cannot have ever had more than 10 years of a DFC grant. So if you've already had a drug-free communities grant, you can't apply for it under the same coalition for the same service area again. And then you have to sign an affidavit that you are not doing that. The parts of the Drug-Free Communities Grant are first the narrative application. And the narrative application, the coolest part about the narrative application is your components are going to come mostly from your community assessment and your logic model. So if you're working through the strategic prevention framework and you've worked all the way through that spirograph, you're going to have all of the elements that you need to write a strong application. As a peer reviewer, I can tell you with confidence that if you are not writing your grant to a logic model, you are going to be much less likely to be funded. I think sometimes people hear logic model and it feels intimidating. Logic model process is pretty scripted, it's pretty straightforward, and it's pretty easy. So start with your community assessment, start with your logic model, and then all of the other pieces of your narrative application are going to be able to fall in place. So there's a project narrative, and the first section is the background. The background is really going to be pulled from your community assessment because it's going to ask about the need for this funding in your community. It's going to ask about the problems and the consequences in your community, and all of those elements, all of those data should be in your community assessment if you have completed it comprehensively. They're going to ask you about your approach, and your approach is going to be tied to your logic model. So the purpose is going to tie to your logic model, and then it's going to ask about your outcomes. How are you going to achieve these outcomes? That's going to be from your logic models, and then also your evaluation plan, which ties to the evaluation piece on the strategic prevention framework. Your strategies and activities are going to come from your action plan. And if you work through the strategic prevention framework, you'll have a comprehensive action plan based on all of your logic models. And so you're just going to go through your strategic and action plan and pull out all of the activities that fall within the 12-month period of the drug-free communities funding, which is September 30th through September 29th. Why it's not just October 1st to September 30th, I don't know. You're going to have to ask somebody with higher security clearance than me, but that's what it is. So in my brain, I just tell myself October through September, but technically it's September 29th through September 28th of the next year. You'll be asked about collaborations. This is where you talk about the 12 sectors and how all of those people are integrated into the coalition and how they contribute to the work of the coalition. It's pretty evident from a peer review standpoint if you don't really have a coalition. If it's just one person running the show and there's nobody to help, your peer reviewer is going to know. And the whole purpose of this program is for community collaboration. And so really building a coalition is half the battle here. I think that when it comes to the work, you're going to be very frustrated if you sit down and try to write this grant by yourself and try to do the work by yourself. And if you write the grant by yourself, chances are you're going to be doing the work by yourself. So enlist some support in your community is my best recommendation to you. You're going to be asked about your populations of focus and the health disparities that exist within that population. In my experience, all federal grants are now asking for this information. So we're really moving to that place of truly identifying health disparities and then finding a way to include in your strategies how you're going to overcome those health disparities and meet people where they are with the resources that they need to maximize their wellness. You'll be talked about how you're going to evaluate your work. Many organizations choose to hire an evaluator here to help with this and come up with a performance measurement plan. That ties a bit to your evaluation plan, but an evaluator can still help with that. You'll be talked about your organizational capacity to implement the approach. And this is really going to be on the financial side of things. They're going to want to see if you've had project management experience. They're going to want to see if you've implemented any other grants effectively. But sometimes people apply for this grant the very first time, and we all have to start somewhere. They're a brand new coalition and they haven't had a grant before. Doesn't mean you're not going to get it. You just have to talk about the systems that you have in place to make sure that you're organized in such a way that even if you don't have the paid staff, you have the volunteer capacity to be able to implement the approach effectively. Then you'll talk about your approach. You'll talk about your work plan, which again is just your action plan. You're going to talk about your timeline of what you're going to implement and how you're going to implement it and who on the coalition is going to help. Because guess what? CDC and ONDCP know that one person cannot do all of this work on their own. So they're going to be looking to see who else in the coalition is going to help you with that. And then you'll include a budget narrative. The budget narrative is not scored, but you will have to let them know how you're going to spend your money, and you'll have to show evidence of where that 100% match is going to come from. There are attachments with respect of those required components of the Drug-Free Communities Grant. You've got to have a sector table. So that sector table, and this information comes directly from the NOFO, the Notice of Funding Opportunity. So if you want to pull this up, you can pull up last year's Drug-Free Communities Grant NOFO. If you're planning on applying, I would go ahead and pull up last year's NOFO and just begin to become familiar with it. There are likely to be a few changes between fiscal years, but I don't anticipate this year. I've not heard that it will change dramatically. You will have in your sector table the list of names of the people who filled out the coalition involvement agreements, so those do need to match. You'll have to provide your assurance of your DFC 10-year funding limit, meaning your community has not been funded for more than 10 years. You'll have your statement of legal eligibility. That'll be your 501c3 documentation or that of your fiscal agent with a memorandum of understanding. You'll have general applicant information. This is going to be your system for award management number. This is going to be your contact information. It's going to identify who the key players are. It's going to help them know how to contact you. And then there's a congressional notification. You have to know your congressional district. You can look it up on grants.gov. It's really easy. But the way that grants go is when a grant is funded, the federal department notifies the congressional staffer of your district before you are notified. Sometimes a congressional member will reach out and say, congratulations, you're funded, before you actually get a notice of award. It's just a courtesy that the federal government does to Congress. Other required evidence are your coalition meeting minutes that I mentioned. You'll have to submit 2 sets of minutes to show that you've been in existence for 6 months, and they have to be within the past 12 months. You will provide resumes of key personnel who are going to be involved in the project, and then a letter of mutual cooperation, if necessary, with a fiscal agent or other entities. Here's some key details about your grant. You do have to be a 501c3 or have a fiscal agent. I know I've mentioned that several times, but this is really critical. People who don't already have a 501c3 sometimes are scrambling at the last minute and don't get to submit their application because they can't find a fiscal agent at the last minute. So this is something that we plan for early in advance. You also have to register with SAM, which is the System for Award Management, and you have to get a UEI. The UEI is a unique entity identifier, and y'all, this process is not overnight. This process takes a while. The last time I did it, it took 2 months. So this is something that needs to be done well in advance. It is not the most inherent process to work through. So make sure you allow yourself plenty of time to work through those nuances to make sure that you get your UEI and SAM registration in time for the deadline of the grant. You'll also want to have a grants.gov account. Grants.gov and the System for Award Management work together through the federal entity of login.gov, but you do have to have accounts for both. And then you'll want to identify roles. You'll want to have a primary investigator, a business official, and an authorized organizational representative from your organization. So those are the things you need to be thinking about if you're thinking about applying for a DFC grant. I looked like nobody had ever applied for a DFC grant in this group before, so I'll just give you a few tips, especially since we're running a little bit short on time. But when you're registering your nonprofit to apply for grants, just make sure that there is an email account that is going to be easily accessible to multiple people. Because if there's turnover, for example, and Burke applies for a grant under Burke's email address, and then Burke wins the lottery and takes a huge vacation, Coalition gets funded, all of those user accounts are going to be inaccessible to everybody else. What I do with my organization is we have a grant email account. So the president of the board has that login information. As the CEO, I have that login information. And then our board secretary has that information as well. So if there's ever any transition or any turnover, or if something happens, then I'm not the only person who has access to that information. Make sure, and Francesca just popped the NOFO FAQs into the chat box, which might be really helpful. Also make sure that you allow plenty of time. If you're gonna apply to become a 501c3, you want to apply, or you want to allow at least 8 to 12 months for that process to register with the System for Award Management and grants.gov. You want to give yourself at least 3 months to work through that process. So just make sure that you're starting on time, that you're allowing yourself plenty of opportunity to get things done, so that you have the amount of time to focus on that grant narrative and not being stressed out about all of the things that you could have done in advance. So start on those things now if you want to apply next year. And that rounds out our session for today. We've worked through all 5 of our objectives, and coming right in the nick of time. So I'm going to stop talking. I'd like to open the floor for questions. If anybody has any questions that you would like to ask from our content today.
I'm going to go ahead and pop the evaluation link into the chat. If you could please complete the evaluation link, that just helps us get some good feedback, and it also helps verify your attendance for CEs. Please feel free to ask any questions now. And then I'm also going to pop in the links for all of our upcoming DFC preparedness trainings, as well as today's this afternoon's training, which will be on cultural competence. And then if no one has any questions, you are all free to go. But please feel free to stay on and ask any questions that you may have. But thank you all for being here. And I'm looking forward to seeing some of you at our next sessions coming up.
Thanks, everybody. Have a great day. Hope to see you this afternoon.